Tourette syndrome is a genetic disorder, which means it results from a change in genes that is either inherited or occurs during development in the womb. Hello everyone and welcome to Info 360. I'm your host Alan, and in this video, we're going to look at Tourette syndrome. The exact cause of Tourette syndrome is unknown, but some research suggests it occurs when there's a problem with how nerves communicate in certain areas of the brain. An imbalance in neurotransmitters might play a role. For those who don't know what neurotransmitters are, they are the chemicals in the brain that carry nerve signals from cell to cell. People with Tourette syndrome usually first notice symptoms in childhood or adolescence. The condition affects individuals of all races and backgrounds, with more males than females affected. It commonly appears between the ages of 2 and 21 years, with the majority of cases occurring in children aged 4 to 12 years. Tourette syndrome is estimated to affect 0.5 to 1% of the world's population. Tourette syndrome is not contagious. You can't catch it from someone who has it. It causes uncontrolled, sudden, repetitive muscle movements and sounds known as tics. There are two types of tics associated with Tourette syndrome: motor tics and vocal tics. Motor tics are sudden, uncontrollable movements such as exaggerated eye blinking, grimacing, head jerking, or shoulder shrugging. Vocal tics include repeated throat clearing, sniffing, or humming. Tics can be simple or complex. Simple motor tics usually involve just one muscle group, such as eye blinking or grimacing. Complex motor tics usually involve multiple muscle groups and might appear as a series of movements. In rare cases, individuals with Tourette syndrome might have a tic that causes self-harm, such as head banging. Simple vocal tics can be throat clearing, sniffing, or grunting. Complex vocal tics can involve calling out, repeating other people's words, or involuntary swearing. During periods of stress, tics can become more severe, frequent, or prolonged. The type of tic may also change. Some individuals with Tourette syndrome can suppress their tics temporarily, but eventually, the tension builds and the tic must be released. Focusing on controlling tics can make it difficult for individuals to concentrate on other tasks, such as having a conversation or paying attention in class. While living with Tourette syndrome isn't easy, there's good news. Tics usually become milder or diminish during adulthood. Just as Tourette syndrome varies from person to person, treatment approaches also differ. Although there's no cure for Tourette syndrome, most tics don't significantly interfere with daily life. If they do, doctors may prescribe medication to help manage symptoms. Tourette syndrome is not a psychological condition, but doctors may refer teens to psychologists or psychiatrists. Therapy won't stop tics, but can provide support in managing stress, learning relaxation techniques, and addressing other issues like ADHD, OCD, or anxiety. Is Tourette syndrome the same as autism? No. Tourette syndrome is a neurological disorder characterized by repetitive, involuntary movements and vocalizations known as tics. These tics can range from mild to severe and typically appear during childhood. In contrast, autism spectrum disorder is a developmental disorder that affects social interaction, communication, and behavior. It presents with a wide range of symptoms that can vary in severity and presentation. While Tourette syndrome and autism can co-occur in individuals, they are distinct conditions. This means someone may have both Tourette syndrome and autism, but they can also occur independently. It's important to note that Tourette syndrome is not a form of autism, though they may exist alongside each other. If you enjoyed this video, please like, comment, and share it. To watch more interesting and informative videos like this, please subscribe to Info 360.